Hello and welcome to Wellness Central, where wellness is essential. Today, we're going to be delving into the ominous and subtle signs that your body may be experiencing a stroke at least 30 days before it happens. Our bodies are like delicate machines, communicating and telegraphing important information to us 24 hours a day, 7 days a week, 365 days per year. Believe it or not, although our bodies are relaying critical data about our current and future state of health and well-being in the moment, more often than not, we have a tendency to ignore these subtle signs and symptoms, especially when we have no clue what we're listening for. Our body's keen ability to communicate symptoms to us is only as effective as our ability to heed its pleas and take precautionary action to maintain our health and well-being. Today, we'll be unveiling the 8 leading warning signs of an impending stroke, at least 30 days prior to an eruption. This video can save your life or a loved one's life. So sit tight, take some notes if you can, and let's listen intently to the subtleties that our bodies are communicating with us every day to save us from ill health and disease. This video just isn't about taking precautionary measures to maintain your health or prevent an illness. It is an advocacy towards self-help, individual autonomy, and self-awareness, all critical qualities necessary in the pursuit of health and well-being worldwide. Since 2021, we've seen pretty disturbing numbers in the arena of cardiovascular health and disease in the global population. Today, we take a step forward in the right direction, empowering each other with the information to save lives. At number 1 is 1. Fatigue. Feeling worn out or constant fatigue can also be an unexpected clue that a stroke may be imminent. It's like a subtle warning sign that requires further investigation. As we remove the layers, we discover some intriguing relationships. Lack of sleep is a major factor in this, adding additional strain to your body's delicate balance and making you feel more exhausted than you actually are. Fatigue is like your body's way of telling you that something may be wrong. An unbalanced diet can enter the scene, disrupting your body's harmony and possibly raising the risk of a stroke. Stress itself is another character in this narrative that discreetly affects your well-being. 2. Issues with vision. When it comes to vision problems, there are a variety of common concerns that we should pay attention to. Blurriness, seeing double, or even experiencing partial or complete loss of vision in one or both eyes are all part of this warning system. Vision problems can actually give us some important hints about potential strokes. They're like the body's way of raising a flag, telling us that blood flow to the brain might not be going as smoothly as it should. 3. High blood pressure. The most significant recognized risk factor for stroke is high blood pressure, sometimes known as hypertension. Normally, we consider blood pressure to be around 120/80ths, but if those numbers consistently rise to over 140/90ths, it's a sign of high blood pressure. To visualize blood pressure as a measure of the force with which your blood gently presses against the walls of your arteries as it circulates through your body, think of it as being driven by the rhythm of your heart. Blood pressure isn't just about numbers. It's a gentle reminder that our blood vessels, including those that connect to our brains, are under increased pressure. As a result, the heart must work much harder to maintain blood circulation. Now, let's talk about how high blood pressure and stroke are somewhat similar, but not in a good way. High blood pressure weakens the arterial walls and may even hasten the progression of some cardiac conditions. It may also cause these minute clots or plaques to break off and obstruct blood flow to the brain. Definitely not good news. It's important to remember that high blood pressure increases the risk of stroke, so it's important to keep those numbers under control. 4. Abrupt and intense headaches. Abrupt, intense headaches are the body's way of waving a flag, especially if they are accompanied by other symptoms. Headaches come in a variety of forms, so it's important to understand their origins. There are several types of headaches, including tension headaches, migraines, and the common sinusitis. However, there is a link between severe headaches and strokes that we shouldn't disregard. We can act quickly and possibly reduce the risk of a stroke by putting these pieces together. So let's pay attention to these signals and keep ourselves on the right track if your head is pounding and you have some other symptoms lingering. 5. Feelings of numbness, weakness. Feeling numb or experiencing weakness in your face, arms, or legs isn't just a temporary sensation, especially when we're talking about strokes. Let's examine the potential causes. When it comes to numbness or weakness and strokes, there is a relationship we need to understand. Behind these sensations, we have pinched nerves, arthritis, and even carpal tunnel syndrome. They are likely the usual suspects. Understand that these feelings are your body sending out signals that we shouldn't ignore, and that if you notice them, especially if they appear in combination with other symptoms, it's a signal to take action. Feeling empowered? Great! However, our job is not yet done here. If you're loving this content, go ahead and hit that like button, and don't forget to subscribe to our channel for more life-saving tips. Moving forward at 6. Memory problems. The difficulty to recall details clearly is just another aging symptom, despite the fact that this may initially seem normal. According to research, memory loss may signal the beginning of a stroke. The significance of memory lapses as potential signs of various underlying health conditions has been explored in a recent study by Erasmus University Rotterdam. While past studies emphasized the likelihood of stroke leading to memory problems, the results that were published in the journal Stroke show a striking relationship between memory loss and an increased risk of stroke, particularly among people with a higher level of education. This study used a novel approach to examine whether cognitive issues could be stroke precursors. The findings showed that people with greater levels of education who reported having memory lapses had a 39% higher chance of having a stroke. In particular, this group included people with advanced degrees in a vocational field or equivalent training. 7. Loss of balance. Loss of balance serves as a significant indicator of a potential stroke because it implies damage to the brain's coordination center. This center, which is located inside the brain, is in charge of coordinating different sensory inputs and motor outputs to ensure smooth and precise movements. When this center is damaged, it can cause a loss of equilibrium and balance. Several factors contribute to the loss of balance, including inner ear problems, muscle weakness, and medication side effects. The impulses delivered to the brain for spatial orientation and motion can be disrupted by inner ear issues such vestibular disorders, which will negatively affect one's sense of balance. The body's ability to maintain stability and adapt to changes in position is impacted by muscle weakness, which is frequently caused by a variety of underlying health conditions. Additionally, some medications can have side effects that impair balance, such as dizziness, drowsiness, or changes in blood pressure, all of which increase the risk of falling and losing balance. 8. Difficulty speaking. Struggling to talk when you have strokes is serious. It's your body's way of warning you that something might be wrong with your brain. You may stutter, mumble your words, or have difficulties coming up with the proper words. It seems like your brain and tongue are attempting to sync up. They're all elements of the puzzle. Understanding the link between speech issues and the risk of stroke is crucial. Take into account that your body sends signals that we should pay attention to if you have these difficulties, especially if they co-occur with other warning indicators. It's like a gentle nudge to act proactively. Currently, there is no substantiated evidence directly correlating precautionary signs and indicators with the onset of a stroke. Nevertheless, a multitude of risk factors do exist that can perpetuate and propel an individual down the slippery slope of ill health, leading to overall cardiovascular disease and the possible onset of a stroke. These include elements such as elevated blood pressure, chronic tobacco use, diabetes, elevated cholesterol levels, and vascular disease. For this reason, and many more, we at Wellness Central always advocate for patients with these conditions to seek proper medical advice from their physicians and to monitor their symptoms vigilantly when they arise subtly. Thank you for watching this video and potentially saving a life. Again, don't forget to like this video and subscribe for more life-saving content such as this one. Comment down below with any feedback you may have. Thank you for visiting Wellness Central, where wellness is essential.